Good morning and good day. This is about AI, artificial intelligence in triage. All along, I was talking about how AI can probably help in home care. You have discharged a patient, still his recovery is going on, and can you deploy AI there? Now, we are trying to look at AI whether it can make core clinical decisions. Core clinical decisions are a very delicate issues, not to be taken lightly, even when there is a human doing the decision, more so if you have endorsed it to an AI. And that too in triage. The clinical decisions in triage can have a lot of repercussions if it is not done right. So the clinical image and scenarios are from my personal collection, but I've introduced a disclaimer, again emphasizing that AI is a tool at best as of now, and it can never be a one size fits all, because some of my students on WhatsApp or on my YouTube channel, they do ask whether AI can completely take over a doctor's job. No, it cannot. Now, this is a sort of an eye-opener for the patients that AI will not take over doctors, and it is also an eye-opener for the healthcare professions that at some point, not because to reassure that they will still find jobs, it is to warn them not to depend on AI because it is not going to take over their jobs anytime. So AI has to be looked in at with a 360-degree before it gets deployed into the clinical decision making system. So we are talking about triage. This is a usual casualty and accident and emergency, whatever you want to call. And this is a non-busy hour actually. You see the crowd. You can imagine the busy hours. Busy hours are usually after 4:35 when the OPD services will close in most of the hospitals. So naturally the crowd will tend to migrate towards the accident and emergency, and along with that you also have emergency cases. So if you have a look, you can see there is one doctor here, one here, one here, one here, looking after all these, trying to triage these patients. You see the crowd there. Now, not only that, they have a lot of documentation to do also in this highly charged atmosphere. Now, your medical legal documentation for a small scratch on the hand is the same amount of paperwork that you would be doing for a patient who comes with a pelvic fracture and in shock. So you can see the amount of work that doctors and other healthcare professionals are put under in this totally over understaffed issues and overcrowding. So what is the importance of triage? Triage means to sort out. It's a French word. It's a process of prioritizing patients' care based on the severity of their condition. Fair enough. Now what does it do? Critically ill patients will be attended first. That is the dictum. Now when you triage properly, you will prevent overcrowding and streamline patient flow. And it also optimizes resource allocation in busy emergency department. Now, if you feel all of them can be put through a conveyor belt and get the same attention, get the same investigations, you will be nowhere. Your processes are not going to move an inch. Now, how do you triage them? There is something known as an emergency severity index. See? Now, this index is not some mathematical calculation. You give some number and try to predict. No, it is a very structured training which is picked up during your medical school. And along with that, you need a real world experience. And you can give a severity score. Now, if you look at it, most of these patients are standing. Fair enough. So none of them are immediately or most urgent or immediately life threatening. That much you know. But there may be high risk patients here. There may be patients who need to be sent off to the OPD itself instead of wasting investigations. So there is a mix here. You need to somehow move in with some sort of triage tool and try to streamline the process. Now coming to the challenges, either you will under triage. What will happen? You will fail to see critically ill patients. There will be a delay leading to morbidity and even mortality. Or you will over triage. All of the ones who came there, you will try to investigate and try to find something. You will end up overburdening the system. Both ways the system becomes inefficient. Now what is the current stage? There is overcrowding. Nursing officers and healthcare providers, there is a shortage, and there is an increased length of stay in the emergency departments before a foolproof decision is made, either to admit or to send home. And to admit where? ICU, high dependency units, or in the wards. So what happens in this wait times? Patients are likely to leave without being seen, or they will do half the investigations and go off. Both ways, it reflects the inefficiency of the system. How can we improve? Yes, with training, building up resources, etc. And we are trying to see whether AI is coming to help in these situations. So what is the role of AI in enhancing triage? It can extract symptoms from the clinical notes. If they have an electronic health record, it can extract these symptoms and prioritize care. It can predict levels of risk. There are tools known as Triage Go and it's being deployed. What are the benefits? It reduces subjectivity. Suppose over one patient, there are two healthcare providers who feel, no, this is not urgent, patient can go to OPD. And one of them says, no, they need to be retained in the ER. It's a very subjective, at times it can get subjective. So AI with its objectivity may be able to sort it out. So look at this. This triage, you can see there is a person here. The triage will happen to send to investigation between two patients who needs a CT, who doesn't need a CT, and if two patients need a CT, who needs the CT first, including the priority to use the hospital wheelchair. See, and then sending for lab works, and then sending for operation theater, sending for lab works, also sending home. That's how triage will be able to help in streamlining processes. Now, have these triage software been used? Yes, it's being used, of course, with a lot of human oversight. It cannot be left autonomous. It's being deployed in the John Hopkins, and because preliminary results have said yes, it can help. Of course, with the human oversight, it has been deployed in the other hospitals also. Now, whenever you deploy an AI-based decision systems, you have to repeatedly evaluate. That is very important. Repeated evaluation is very important. Now, can AI solve all the problems? Can AI solve all the problems? No. If downstream infrastructure is having bottlenecks, they need to be resolved also. Now, suppose these patients have been triaged, they have been manually triaged. None of them are sitting without triaging. They have been decided what to do with them. See, all of them have been decided to admit, to go home, or to wait for beds, or to go for x-rays. But even after triaging, you see a big wait list there. You can also see a lady who's had an IV line put in place and waiting for beds. So you also need to improve the infrastructure. Otherwise, just triaging, you would have given a label, but they would not be getting the appropriate next course of action. Now, these slides are definitely not to bring in criticism about why there is overcrowding, and definitely these slides are not to bring in armchair solutions. That was never my objective. If you look at these slides and think how best I can bring in AI, how best an AI will help, how the best AI may still not help, these questions you should have in your mind rather than using these slides to criticize and to find sure shot but armchair solutions. So thank you very much. And this is on behalf of Dogstripe AI, the company where I work as a subject matter expert. Now, as I told you, AI, you read about it. This is for students basically. You read about it, you find out what exactly it's going to do, what it is doing, how it developed, what is it doing, and what is the future of AI. And I definitely don't want students to go with the message that AI here is going to decrease their burden of cognitive skills. No way. In fact, it might even be an add on to your learning process. You need to be more alert now when an AI is deployed into the system. And please do comment. I'm very happy when there is a critic and a criticism because it makes me grow for the better. Thank you.